Hello. For my job, I'm a dental nurse, and this isn't really a job that I ever saw myself doing exactly. Even when I applied for this job, I didn't have any qualifications in medicine or dentistry or anything like that, so I thought that instead of training me to be a dental nurse, they would probably, well, maybe I would have a chance at getting a job as like a receptionist or in admin or something like that. Yeah, but then they did offer me this job as a dental nurse, and I think it's an interesting job, and I'm always very proud of myself for this job. I think working in any sort of medical field is sort of a bit of an honourable thing to do, because you're helping people for the most part. Hopefully, yeah. Hopefully, people, they come to see you and they leave either the same as they were or better off. You know, you can get people out of pain and help people and stuff like that, and that's very good. Yeah, and I do things that they're quite interesting, and I think I'm quite good at my job and quite skilled. And sometimes my job makes me feel grateful, in a way, not just because I've been able to do this job, but because there's problems that I didn't even know existed, and like there's people on like a weekly basis or on a fortnightly basis. We do root canal treatments. I've never had a root canal treatment myself, and before coming into the job I wouldn't have known anything about it, but now I assist in doing root canal treatments. And yeah, I'm grateful that I haven't needed such a thing. And some people, they have wisdom teeth problems, and wisdom teeth that grow the wrong way, like it grows sideways into the other teeth and are poorly positioned and need extractions and stuff like that. And I don't think I have wisdom teeth, let alone ones that are poorly positioned and require extraction or anything like that. Yeah. So in that sense, I feel quite grateful, and yeah. And occasionally there's interesting cases and things like that, and I am proud of my job, and I do find my job can be interesting. Obviously, there is times where it's not so interesting, but there is times where it is interesting, and so forth. This week we had a patient who was 28 years old, and they're having pretty much all of their teeth removed because they haven't been to the dentist in a very long time, I guess since their parents stopped taking them or something, and now their teeth aren't in good condition, and their oral health is not so good, and they have bone loss and so forth. Now they have to have the teeth removed. And it's very sad, I think, because I'm not sure what will happen now for them. We've had a patient like that before, and we sent a referral form to hospital for him to have his teeth removed, and then I don't know what happened to them next. But this time the person wanted us to remove their teeth in surgery, so we started doing that, and it was a lot more impactful, I think, on me. I'm thinking, I don't know. I don't know what will happen to him next. Because he's 28 years old, and now for the rest of his life, he's not going to have teeth there. And I don't know what will happen in that regard. Whenever he goes for a job interview from now on, or if he wanted to get a partner in life, like if he wants a girlfriend or a boyfriend or something, he's not gonna have teeth. He'll have dentures, but he'll have to manage with dentures. And if you get dentures at such a young age, I'm not sure what impact that has on the rest of your life. Like, some people who are really old and have dentures can't manage to get them to stay in and have to use fixodent glues and stuff. If at 28 years old you have dentures, I'm not sure what the prognosis is on how long they'll be able to stay in, or if they will stay in, I don't know. And if he starts having to use glues now, is that a long-term solution? Will that last him for 50 years or something? I don't know. So sometimes my job is interesting, and sometimes there is big cases. I don't know. I'm not sure what happened, but it also makes me feel a bit grateful that I don't have such problems as well.